Yesterday, there were more than 4,600 tests administered in the Western New York region, and 40 of those came back positive. And for those who have gotten tested, you may have noticed it's taking a long time to get those results back. Dave McKinley says this is raising a real concern on several levels.
Much of the problem is due to a nationwide shortage of reagents, which are the chemicals needed to run the tests. It's resulted in delays in the ability to get test results back quickly. Governor Cuomo was asked about it during a conference call with reporters today.
It's not a concern here, but it is a concern in other states, I can tell you that.
But that's not what we're being told by a doctor in Buffalo.
Yeah, it's a real big issue because, in the beginning, we were, at least for the COVID test, we were getting it back in 2 days,
Now he says it's taking up to 2 weeks. He and other doctors say this leaves both patients and physicians in a quandary.
I mean, obviously, first of all, if you don't know whether you have it or not, you can't get treatments that might be useful to you. Also, during that time, a lot of people are going to spread the virus to others.
Dr. Vasquez also notes that when you can get a result in a day or two, the person is still in the infectious stage where contact tracing can be of real use to curb the spread. But when you have to wait 2 weeks,
it becomes almost a useless test. If you're going to find out the results by then, there's not really much you can do with the contact tracing to prevent or cut down on the number of people exposed.
In New York in particular, tests have become required on a routine basis for healthcare workers and for any patients going into hospitals for elective surgeries. Even barbers are supposed to be tested at least every 2 weeks. That's a lot of tests and a lot of reagents adding to the nationwide shortage. Coming up at 5, local officials weigh in on the delays in test results. In Buffalo, Dave McKinley, Channel 2 News.